This is an easy video for us, but I think it's an honest video. So this is my honest opinion. Kasi isa ito lagi sa mga pinaka tinatanong sa atin ng ating mga ka-community sa Filipino UK nurses. Ang kanilang tanong, Manong George, ano po ba ang signs that I should leave work? Alright, let's start with this. Naranasan mo na ba na papasok ka sa trabaho mo pero natatakot ka? Yung parang feeling mo magkakamali ka or let's say parang sabihin mo, uneasy ako, may anxiety ako. Ngayon, more often than not, kung ganyan yung nararamdaman mo, ibig sabihin nun may mali na sa work. No? It might be a lot of factors pero there is something at work, maybe bullying, harassment, whatever, na that's making you feel this. Ngayon, again, kung ikaw hindi ka na komportable, later on, maapektuhan ng iyong trabaho.
I'm not happy at all. Not one little bit.
And if pag naapektuhan ng trabaho mo, it will come up in your performance, hindi na maganda. So, if you have this, then this might be a sign, maghanap ka na ng iba. Moving on, do you feel safe at work? When I say do you feel safe at work, may dalawang aspeto yan. So, una, safety mo. Paano yung safety mo? Pinangangalagaan ba kayo ng iyong employer? Meron ba silang ginagawa to make sure that your welfare is being taken care of? Diba? Next, paano naman yung safety in practice? Which, it affects the safety of your patients.
Not safe here.
Sure, yung demand ngayon ng nurses sa UK mataas. That's right. Kasi talagang may pagkukulang. Pero is the management doing something for that? You know, hindi yung hinire lang kayo and then that's it. Diba? So, kung hindi aligned yung values na yon sa values mo, which is hopefully always paramount ang patient safety, baka it's a sign. Hanap ka na ng iba. Next, let's talk about career growth. Career growth is important, lalo na para sa ating mga healthcare providers kasi there's a good chance for us to stagnate kung hindi tayo gumagalaw. Anong problema if we stagnate? If we stagnate, our salaries might not improve, you know, our opportunities might be stymied, di ba? Maunti lang. Sa totoo lang, ang ating profession it's non-stop learning, no? So, yes, there's nothing wrong kung if at this time you have to stop learning and progressing for a host of reasons. There's nothing wrong with that. Pero if you are somebody who wants to move forward and hindi yun available sa iyong lugar, sa iyong trabaho, then maybe you might find that somewhere else. Kasi maaaring this might be a sign na walang opportunities dun sa current employer mo, or you might be undervalued too.
I'm moving on.
Kung pumasok ka dito sa trabaho na to, you have to picture yourself working in there. Diba? Na nandun ka na. Ngayong nandun ka na, nagtatrabaho ka na sa lugar mo, can you picture yourself staying there for long term? And when I say long term, siguro sabihin na natin, let's start at 5 years. You know? Kasi ibig sabihin nun, you have that drive, that commitment na, and maybe there's a lot of things that is working for you whilst working in that place, no, in that hospital, care home, facility, whatever it may be. So, kailangan yung ganun eh. Kasi if you have that drive, then maiisip mo, then you will make it work, di ba? Parang you can take the good and the bad, and then you can make something better. Pero kung hindi mo ma-picture yung sarili mo staying in that place for long term, then I suggest, hanap ka na ng exit plan mo.
Let's get out of here. What do you say?
Kasi, what's the point? If you feel na this is just a stop, then the more na kailangan, meron kang backup plan. So, yun. Pag hindi mo na ma-picture yung sarili mo staying in that place, then, again, might be time to move. Now, kanina ko pa sinasabi, di ba? O, lipat. Time to move. O, baka ito na yung sign. So, ano ba yung concrete sign? Simple. Right? Pag nag-apply ka, merong better offer. Alright? Ganun lang kasimple. If you find na yung salary works, say, commute works, or malapit lang sa bahay mo, benefits work better, it should be a no-brainer. Diba? Kasi, ito yan eh. Mahirap yung halimbawa, nag-apply ka, naghahanap ka ng trabaho, or simply because kasi doon sa lugar mo, sa current employment mo, parang you're not happy na, no? Hindi mo na sure, hindi ka na sure. So, parang may pag-aalinlangan ka na, kaya ka na tumitingin sa iba. Tapos, nung nakuha mo na yung mga offer sa iba, sabi mo, balik na lang ako sa dati. You know what? Ito yung mga totga. The one that got away.
Alas, that one got away.
Kasi, pag bumalik ka talaga doon sa pinagtrabahuan mo, yung current mo, kasi sabi mo nga, sige, dito na lang ako kasi komportable ako. What would happen is that when that ship sails, you know, yung mga in-applyan mo at wala na, you'll never really know what could have happened. So, you know, the best way to go is pag mayroong naghanap ka na and there's a better offer, go for it. That's my personal opinion anyway. And ayan, so it's nice and sweet tong ating video. I didn't want to overload you. Kung may mga tanong kayo, please feel free to message me on Facebook. Mas madali ako makontak doon. But if you want to join such engagements, no, join our community, Filipino UK Nurses on Facebook. We are 34,000 people strong na doon. And we always welcome nurses who wants to go to the UK or are in the UK, and let's have that discussion. And for everything UK living and UK nursing, always remember, Manong knows.
Manong knows best, put your worries to rest when staying in the United Kingdom. Manong knows best.